Great. Hi,
All
Heather.
right. Hey. Hi, David. I'm Heather. I'm Heather the hygienist. And it's so nice to meet you.
Nice to meet you as well.
I just wanted to give a brief introduction, kind of why we're here today. We're here to actually talk spit. I know that sounds funny, but this is going to be a great topic of conversation because it's something that really doesn't get discussed much. And my background is I've been a dental hygienist for, I won't even say how long. It's been over 25 years. And I actually have an all natural oral care line. I've written a couple of books and I offer the test that you guys actually invented and a couple other tests because I feel that there is a huge gap when it comes to understanding root causes. And I'm just so excited that you're on here today because I really want people in general to understand the importance of their oral health in relation to their systemic health. So if you could just introduce yourself and how tell me how you got involved in this company and how this
Yeah,
came about. I would love to hear your story.
absolutely. Thanks for having me. So my background is in microbiology.
Mm.
So I graduated a while ago from UC Davis, where I studied microbiology. Um, and at the time, I was studying how bacteria can make ethanol because I was very interested in
Mm.
biofuels. And then after that, I did my master's studying antibiotic resistance, actually. So now they're called superbugs, but they're these
Right.
bacteria that cause these hospital-acquired infections, and they're really difficult to treat because we've been overusing and overprescribing antibiotics.
Mhm.
And so now most of them just don't work. Um, and then afterwards, I received my PhD at the University of Michigan, where I studied how viruses infect cells.
Mhm.
So it's kind of switched from bacteria, but now I was looking at how dengue virus is actually and how it causes disease. And then afterwards, I did my postdoc at Genentech back in California, where I studied um, the microbiome. And the reason I got into this was actually the neighboring lab during my PhD studied the connection between the mouth and the gut microbiomes, and how they were interrelated, and how if you have kind of an infection in your mouth, that can actually cause inflammation in the gut. Um,
Absolutely.
and so I was really interested in that. And so I went to Genentech to kind of look at how the microbiome interacts with your immune system and neurons in the gut.
Mhm.
Um, and then afterwards, I worked a little bit as a scientist doing synthetic biology. And then I met my co founders, and they pitched this idea where um, oral care really could be more data driven and reinvented. So the standard of care really is old, very old technology. It's probing and bleeding on probing, measuring pocket depths, and
Mhm.
actually looking at the physical evidence of cavities. And so we thought, well, why is there not a diagnostic tool to predict whether or not that could happen to you? And so we went on this journey where we found that the oral microbiome is actually a very strong predictor of disease, and rest is history.
You know, I'm so glad we're talking about this topic because as a practicing clinician, I am always trying to get people to understand what the oral microbiome is. So if you can put in layman's terms for, just for the general public to understand what it means when you say oral microbiome.
Absolutely. So the analogy that I always like to use for any ecosystem is like a garden. Um, so you've all seen a garden where there's different types of trees, different types of grasses, shrubs, bushes, and there's even weeds, right? Um, and in a healthy garden, you don't have very many weeds because all of your garden is packed full of uh, these beautiful plants that you like to have in your garden. So maybe they're making fruits for you, or maybe you're making herbs. And what can happen is if you don't tend to your garden, these weeds show up
Mhm.
and they can cause damage, and eventually they can take over your entire garden, right? And so they need constant maintenance. Um, and the oral microbiome is exactly the same way. So the oral microbiome is just the collection of plants that live in your mouth. So these are the bacteria, the fungi, and the viruses They live all throughout your mouth. So they live on the tip of your tongue, at the base of your mouth, in the crevices between your teeth, on the surfaces of your teeth, all over your mouth. There are all these different little niches where different types of things can grow. And unfortunately, there are weeds in there.
Yeah.
And most of the time, the weeds don't really cause any damage. They just kind of live at very low abundance, and they're not that apparent to you. But in people with oral microbiome dysbiosis or imbalance, these weeds grow a lot, just like in the garden, and they destroy the garden.
And going with your garden theme, let's just say someone has been diagnosed with gum disease, or, because unfortunately 100 million Americans don't go to the dentist every year. They go to their grocery store and they buy your typical commercial oral care product. Contains, say, 27% alcohol. I compare something like that to like Roundup because what you're doing is you're disrupting your oral microbiome so bad. So in other words, you're making your situation worse because now it's actually feeding those weeds. It's making that dysbiosis even worse because you're putting alcohol in your mouth, or these really bad chemicals that are not friendly to the good bacteria in your mouth. And we don't want to be wiping out all the bacteria. We need that symbiotic relationship between the good and the bad. So getting people to get balanced is so important, which is why the testing is crucial. Their oral care products are super important because, if you use the right stuff, that's going to help replenish your good bacteria. That's going to help your body do what it's supposed to do. And that's always fight off infection, right? I mean, isn't that what our body is kind of designed to do?
Exactly.
So I want you to explain a little bit how the Bristle Health test actually works. Like, what bacteria are you looking for specifically? And then what kind of recommendations based on the testing can someone anticipate?
Absolutely. So the way the Bristle test works is you spit in a tube and you send it to us, and it takes you about 5 minutes. And we use a method called shotgun metagenomics, which is just we look comprehensively at all the DNA that's in a sample. We remove any of your DNA, any human DNA, and we're looking basically for DNA that belongs to bacteria or fungi or viruses. And so what this means is that we actually can detect, I think to this point, we're talking about maybe tens of thousands of different species of bacteria, fungi, and viruses. Typically in a person's mouth, there's maybe a few hundred, but we detect basically anything. And a lot of times what this means is we can pick up on things that other very targeted tests don't pick up on. So there's other types of technologies that look very specifically at, maybe we're just looking for candida. So we can say how much candida you have. But maybe your thrush is caused by something else. Maybe it's not even candida. Maybe it's not the same type of candida that we're looking at. And the reason that this technology is so important is because gum disease isn't really caused by just one bacteria. It's
Right.
caused by over a dozen. Like over
Exactly.
a dozen different species cause gum inflammation. And so it's really important for us to look comprehensively. Another really important feature of our test is that we can also detect the good ones. So we look for the beneficial bacteria that help to prevent the bad ones from growing. So in this analogy, we're looking for the herbs that prevent the weeds from coming in, or prevent like pests from coming and eating the fruits in your garden. And so we're basically looking for these kind of commensal beneficial bacteria that a lot of other tests don't do.
And in our office, we use actually the office that we work at uses the Hain test, which I'm sure you're familiar with. It's where we take the actual paper points and we stick them underneath the gum tissue. We send it off to the lab, and then the lab sends us back a report, showing us what bacteria they have over threshold, especially screening for AA and PG.
Yeah.
And as you know, PG has been linked to Alzheimer's. So what's so exciting to me with the kind of technology that we are now seeing that you guys offer, that even the Hain test offers, is prevention.
Mhm.
So many millions and millions of Americans have some form of gum disease, and they're just living with it thinking that, oh, it's normal that I get bleeding when I brush or floss. No, that's not normal. Um, the fact that the bacteria in our mouth can also clog our arteries. And what's the number one killer in America? It's, cardiovascular disease. So I feel like there has been this huge gap between dentistry and regular, with doctors, and we need to bridge that gap with early prevention, because the mouth is like the gateway, right? It's where everything starts. There's not a magic fence that stops the bacteria in our mouth from getting into the rest of our organs. So if we can prevent things sooner rather than later, that is so important. And I just love that you guys aren't even in the dental field, and you guys came up with testing that hopefully is going to revolutionize dentistry.
Yeah.
We just need to get the word out there and really educate people, I feel, about what gum disease is, and the fact
Mhm.
that it can link other diseases such as the colorectal cancer, the Alzheimer's, and heart attack, strokes, diabetes, and we can do things to prevent that. And I just think that it's so important that we get this message out to as many people as possible, because they even came out with a case study. I think was it last year, on that if you have gum disease, you have a 9 times greater chance of dying from COVID. I mean, that is crazy. And the whole point of the article was that it's inflammation upon inflammation, and that's really the root of that disease. So when you guys do your testing, what like recommendations? So
Mhm.
are you testing for just the periodontal disease? Like, and when you were talking about candida, what is it that you guys would make as far as recommendations? Like, do you recommend someone go see their doctor if their test comes back a certain way? I mean, what is it that they can specifically anticipate with your test?
Yeah. So our recommendations are entirely geared toward prevention,
Mhm.
because, as you're well aware, there is no cure for periodontal disease. By the time you have 5 millimeter pockets, um, you need some surgery to kind of fix that, but we can fix your microbiome so that the pockets don't get worse. Um, but all of our recommendations are geared towards things you can do at home, things you can do yourself. So we advocate for switching to different types of products like mouthwashes that don't contain alcohol,
Exactly.
because we
Like
do,
mine.
yep, we do need to keep those really beneficial bacteria, and alcohol kills everything.
Mhm.
Um, we make recommendations for different types of toothpaste depending on the results of your test. So some people are very high in uh, karyogenic bacteria or acidogenic species like Streptococcus mutans or
Yep.
Streptococcus sobrinus. And so we recommend certain types of toothpaste that contain arginine or other types of products that can boost the commensals and also help to remineralize teeth to reduce the abundance of those pathogenic ones. And one of the most important tools that we have that a lot of people are not aware of are oral probiotics.
Yeah.
So we recommend a few different types of probiotics depending on your results. So uh, if you, for instance, if you have very high levels of bacteria such as AA or PG, there are a few clinically studied species of beneficial bacteria that you can take as an oral probiotic that can help to reduce those, that are really effective. Um, and so combining all of these things on top of uh, not only products but different types of hygiene regimens, like adding a water pick
Mhm.
if you have very deep pockets, maybe filling it with hydrogen peroxide if you have to, if you have like very high levels of inflammation, um, and even just changing your routine. Some people they don't have a very good hygiene regimen, and one of the things that we like to do is just to make sure people are on top of it. It's like
Yeah,
you gotta pick up
exactly.
good habits. Yeah.
So actually in our office, we have seen really, really great results. And I don't want someone to think that if they get a diagnosis of periodontal disease, it's a death sentence.
It's not.
We have been able to actually regrow vertical bone back.
Hmm.
And again, I think it's really a matter of getting to the root cause. On my website, simplysilvermouthwash.com, I actually offer your test. I offer an oat test, which is an oxalate toxicity test. And also, I do recommend people get screened for the MTHFR mutation,
Mhm.
because if you can find out what your root cause is, that is how you can address the issue.
Yeah.
It's like, if you have a foundation problem with your house, you're not going to worry about wallpapering it or painting it. You're going to fix the foundation. And our bone, that's the foundation for our teeth. So if we start to lose our bone, we start to lose our teeth. And unfortunately, with teeth, they don't hurt until it's too late.
Yep.
I always try and get people to understand the fact that you don't want to wait till you have pain, because if you have pain in a tooth, enamel has no feeling.
Mhm.
So by the time you feel pain, that means that the decay has gotten into the nerve of the tooth. So that's why you feel it. That's why you end up with an abscess. But again, had you gone to the dentist, had you prevented that from happening, you would spend what, $300 getting it fixed as opposed to $3,000, which is, trying to repair that one tooth. Definitely you did recommend a water pick, which is essential. Coming from the dentistry side of things, though, we actually don't recommend hydrogen peroxide very often, because it
Very rarely.
can damage odontoblasts, which are the cells in the teeth. So we actually like colloidal silver, because colloidal silver is a fantastic antibacterial. It does not disrupt the oral microbiome, and it's just really great at kind of keeping everything balanced with essential oils. Um, but I don't want people to think that they're going to, you know, end up losing all of their teeth. Everything's going to have to be amputated. There is no cure. It's really finding out what that person has and getting to that root cause individually. And sometimes it does take a few tests, but the mouth is so amazing, because, we can kind of look inside, and like you said, some things are antiquated with probing, but we can quickly determine whether or not there is some sort of infection going on
Yeah.
just by looking inside their mouth and their tissue. And
Yeah.
and neglect is huge. But there are some other issues, whether it be hormone related, or like I said, with oxalate toxicity, or chronic stress. I mean, stress seriously affects the body, and even teeth grinding,
Mhm.
which can be a big issue for a lot of people.
Yeah.
But I think so many times people ignore their mouth because they're so afraid to go to the dentist. But
Yeah.
what I would love to see is more offices offering the preventative stuff, because again, catching something sooner rather than later. Like I said, it's a $300 filling as opposed to a $3,000 problem. If you're catching in your test that, look, your Streptococcus mutans, which is what causes decay, is through the roof, we need to fix that. And I can't even tell you, David, how many times I see this. We have a rather large elderly population
Mhm.
living in Florida,
Yep.
and dry mouth
Yep.
is such a
Very common.
serious underlying cause, because if they're drying everything out, guess what? That's disrupting their oral microbiome. It's creating like the perfect storm for that bacteria to wreak havoc. And keeping that your saliva at a pH above 5.5, because if it drops below 5.5, that's how people get a cavity.
Mhm.
So we're always trying to teach people about pH balanced. Don't swish with acid, which is pretty much your commercial products are like, Listerine's like a 4.5, I think. So getting them to understand that importance with oral microbiome, with their home care, with the fact that they need an electric toothbrush, they need to be flossing the teeth that they want to keep, they need to come into the dentist and get their teeth cleaned regularly. But I think too, this preventative testing is really, really crucial. And I love the fact that you guys, you're not very expensive. I mean, $100, I think that is a very reasonable fee to have a really good diagnostic test. How many times would you say, say someone's test comes back really high? How often would you suggest someone get testing? Like, should they continue to
Yeah.
get testing until those results come back? Or would you just say, this is something you only want to do once a year?
Yeah. That's a good question. So we like to advocate for as frequently as you would get a dental checkup. So what this means is that some people who are at higher risk let's say they have periodontal disease and they're trying to reduce the risk of getting worse pockets,
Mhm.
um, they probably need more active monitoring than somebody who's
Right.
never had an oral health issue and just kind of wants to know, right? So, in the case where someone's trying to fix something, I would probably say maybe 3 or 4 times a year. Usually an oral microbiome can shift if you're implementing the right changes within maybe 60 to 90 days.
Okay, that was the next question I was going to ask. Like, how long does it take to create that shift?
Yeah, it's probably 60 to 90 days for most people. Um, of course, there's a difference depending on your microbiome and depending on you and your habits, your diet. Um, and there are people who don't really need that much of a shift, right? Let's say they
Mhm.
only have a few problematic species, or maybe they're not really that high, they're just a little bit on the edge of kind of a concern for maybe 1 or 2 species. Maybe they only need to test once every 6 months, maybe even once a year. um, Especially for people who don't experience any oral health issues and our test tells them, hey, looks like you're pretty normal. I would I would advocate for maintaining what you're doing, and then if something happens uh, to your lifestyle, let's say you get sick or something, or you start to experience some issue, some health issue, then take a test. But other than that, um, that's my recommendation.
Well, explain how the test actually checks for gut inflammation. And
Oh, yeah.
when I say gut inflammation, is that also checking for leaky gut? And are they one and the same thing? Are they separate
This
things?
is a good question. So for a long time, we've known that you are what you eat, right?
Right, right.
Anything that goes in your mouth is going to end up in your gut.
Yep.
Um, and it turns out that you swallow about 100 billion bacteria every day because you're swallowing about a liter of saliva. And so, inevitably, some of the bacteria in your mouth are going to end up in your gut.
Yeah.
How that happens, we don't always know. Some of them can bypass the stomach, survive, and then colonize the gut.
Mm.
Um, but usually, this happens only in people who have existing gut dysbiosis. So, what that means is if your gut is already a little out of balance and your garden is a little empty in some of the niches, then anything you swallow is going to end up in there and has the opportunity to grow. So this doesn't mean that everybody who has um, has oral dysbiosis is going to have gut dysbiosis. So the way our gut inflammation test works is, or the gut inflammation score works, is there are certain bacteria in the mouth that we know can seed inflammation in the gut. So there's a lot of research that shows some of these bacteria, if they're overabundant in your gut, you have inflammation. Like it's most likely they cause inflammation. There's other ones in the mouth that actually train your immune system, and your immune system is like an entire bodily organ. So if you have inflammation in your mouth, some of those macrophages and T cells can actually train the rest of your immune system to now attack different antigens that are in your gut. And so some of those bacteria from the mouth, like P. gingivalis, let's say they end up in the gut. Now all of a sudden you've got inflammation in both places. Um,
So do you guys recommend antibiotics at all? Or is
no,
that not something you recommend?
we try to avoid it at as much as we can.
Mhm.
Of course, there are some cases where you would require an antibiotic, um, depending on the level of infection or depending on kind of what's going on in this person's lifestyle. But we always advocate for no antibiotics when we can.
So are you making like dietary recommendations and just probiotics? Or what would be like, say
Yeah.
someone's gut inflammation is like through the roof. What
Yep.
is it that you guys would recommend to get that back into balance?
Yeah. So there are some probiotics and some other tools, like like dietary recommendations, like adding more nitrate or adding some arginine to your diet can actually reduce some of the
Really? That's
species that
interesting.
cause gut inflammation. Yeah. So just for instance, one of them is called Fusobacterium nucleatum. This is a pretty common bacteria that usually, well, I think it's in like 90% of all people, but most people have normal levels, right? They're
Right.
pretty low. But some people are kind of out of whack.
That's the
Um,
one that causes colorectal cancer, right?
that is correct.
Uh-huh.
So, Fusobacterium nucleatum has been found inside of colorectal tumors.
Yep.
And they found that the tumors that are very large have a lot of fusobacterium, and these people have much more fuso in their fecal samples and in their salivary samples. So there's a very strong association between the two. But it turns out that there's some studies that show that adding more nitrate to a diet can actually reduce Fusobacterium nucleatum, because Fusobacterium requires a certain niche, and adding more nitrate increases these nitrate-reducing species that then inhibit the anaerobic bacteria like Fusobacterium nucleatum from growing.
Would you guys have any case studies like of any patients or anything that you've been able to follow?
Yeah, of course. So I can share one with you, actually, which is very relevant. This person actually came to us with dry mouth because she has Sjogren's,
Yeah.
which is a disease of the glands where it's an autoimmune disease. You basically don't make secretions like a normal person would. She implemented some changes after we took her test, because the things that she found were, first, she had very high strep mutans in her mouth, because of course, dry mouth causes oral microbiome dysbiosis, and the way that manifests sometimes is people will have more strep mutans. And like we talked about, strep mutans causes cavities. So the first issue she was actually trying to solve was every time she went to the dentist, she had like 3 cavities that needed to be
Yep.
filled.
See
And
it all the time.
she was tired of it. She was like, I can't do this anymore. What's the problem? And the problem was strep mutans. So she fixed that. She went to the dentist, and the dentist said, well, you look fine. Like, let's just keep a 6-month checkup. And before that, she was going every 3 months and getting a fill, like 4 teeth filled.
Mhm.
So she solved that issue. But she also saw in her test that she had very high levels of Fusobacterium nucleatum. And then it turns out she told her primary care physician. And because I think she was about 40 something, 45 maybe, before 45, her doctor said, well, I guess we can do an endoscopy and check for polyps, because now is kind of the time when you would check. Is a little bit early to start checking for colorectal cancer.
Mhm.
But they decided to check, and they found 3 very large polyps that were precancerous, fortunately, but they did need to be removed. Um, and so she got those removed, and now she's healthy. Um,
That's really encouraging. Again, it's always getting to that root cause, and the mouth is just that gateway where that shows so much that's going on, but yet, we're not making that connection to our overall health. And unfortunately, that's really tragic because again, you've got to have a healthy mouth, or you're just not healthy. You can eat clean as much as you want, you can exercise as much as you want, but if you've got disease in your mouth, you have systemic disease. And I really do feel for the people that come in constantly dealing with decay.
yeah.
But I will say so much of it is really, truly diet related.
Mm-hmm.
The American diet, it's terrible. I mean, we're eating super highly processed foods. The soda, don't even get me started on soda. Soda is like, it's phosphoric acid, which I mean, battery acid has a pH of 1, and soda is what, between a 2.5 and a 3.5. So it takes 3 days for people to come back to a normal pH of 7 with one soda. And so people are constantly drinking this stuff, and then they're wondering why their body is so acidic and they're getting all these cavities. But your saliva, again, everything is connected. So they're constantly in that acidic state. So teaching them that food is medicine or it can be poison, the right diet. If you are going to have a soda, I mean, let's be real. Don't sip on it all day. Have it with a meal, use a straw, immediately rinse your mouth out with water.
Yep.
But it's that concept of that acidity and what it does to your teeth, because our saliva is supposed to be naturally washing our teeth and keeping our teeth clean. So another thing I want to tell people is don't brush your teeth for 30 minutes after you eat, because your mouth it's that oral microbiome. It's trying to remineralize things naturally through your saliva. So you don't want to disrupt that. You want to actually just rinse your mouth out with water, but wait 30 minutes before you brush. That way you're not disrupting what the natural process is, right?
Yeah. Yeah. So just going back to the acidity thing too, like drinking the acidic drinks also fosters an environment that allows for more acidic species to
Yes.
grow.
Yeah.
So like the acid does two things, like it decays your teeth, and then now it also killed off all the bacteria that don't like that. They don't like the acid. And allows for things like strep mutans, Streptococcus sobrinus, to colonize your teeth much better because you just wiped out all the bacteria that normally live there. And
Exactly.
those bacteria, they take the sugar that's left over in your food, in your
Mhm.
diet, and they turn it into more acid.
Yes, we
And
do.
there goes your teeth.
That is so true. And usually what I find is people are generally either more cavity prone or more gum disease prone.
Yes.
I've never had a cavity in my life,
Yep.
but I can build tartar like nobody's business. So
Yep.
if I did not get my teeth cleaned frequently, I would be a gum disease person. Now, I will say what started me on really trying to find out what is wrong with, the underlying causes of periodontal disease is because it's not always hygiene related.
Yeah.
And I know for myself, like I had massive jaw surgery last year. They had to cut my stomach, put fat from my stomach up into my joints, remove the bad discs. I was bandaged shut for months. I was
Wow.
in surgical braces for 10 months.
Wow.
The reason why I say that is because being on a liquid diet, I wanted to make sure that I got nutrients.
Yeah.
So I juiced. I had like spinach and kale, beet, celery, carrots. I was having a protein with like micronutrients and a greens drink. And I started to feel horrible. And I'm like, I have never like been so healthy with, everything that I'm eating, drinking.
Yeah.
Why is it that I just, my stomach felt super upset like all the time. And I'm like, well, maybe it's just because I made such a drastic change in my diet. But I just really started to feel like something was wrong. I was fatigued. I felt like I had more pain. So I started doing research on underlying causes and came across oxalate toxicity.
Hmm.
And I thought, you know what? Just take a test and see what my score is. And oh my gosh, it's like through the roof. And spinach is one of the highest things
Hmm.
that has oxalates. And I was having almond milk in all of my smoothies, which is another thing. So I was so oxalate toxic from having all of these healthy foods that since I got off my surgical braces in June, they say to just kind of like slowly wean yourself off. But I should do a bristle test because I do want to see where my gut inflammation is now
Yeah.
that I've been making those dietary
Yeah.
changes. I want to see where I'm at because I've been doing more probiotics. But it
Yeah.
was just like, you would think that eating that way, I would have felt great, but
Yeah.
my body
Yeah.
just was not able to handle all those oxalates.
Yeah. So one great takeaway from this is that all of health is basically entirely personalized,
Yeah,
right? Everything is custom for you
so
because
true.
the way that uh, a lot of primary care physicians and even dentists are treating patients is with kind of a broad stroke,
Yep,
right? And they're saying,
absolutely.
this has worked for everyone else. This has worked for, 90% of the people that I know, so it's got to work for you. And
Uh-huh.
it turns out that's not the case. Like, we can't just make the same recommendations to every single person because everyone is unique. They have
That
completely
is
different case.
so true. And um, it's the same concept that with smoking, someone could smoke for 50 years
Yeah.
and never get cancer,
Yeah.
right?
Yep.
One person could smoke for 1 year
Yep.
and get stage 4 lung cancer. I mean, we don't know what that person's toxic overload is to push that person over the edge of
Hmm.
their health and their immune system. And that balance that they really need between their mouth and their gut. And now the fact that we're able to kind of find things earlier, I mean, that's to me, that is so super exciting. The fact that
Yeah.
we're able to intervene. And, like with that lady, I'm sure you guys saved her life really with being able to say, okay, this was out of whack. Let me go to my primary care.
Mhm.
And thankfully her doctor didn't blow her off,
Yeah.
and
That's the other thing. Yeah.
exactly. you
A
know,
lot
you,
of doctors would.
you need
Yeah.
to, absolutely, you need to make sure that you are really being listened to.
Mhm.
If you feel like something is wrong, then, you know, because to be honest with you, I was telling my doctor, you know, certain things and they just kind of like blow it off, you know, and I'm like, I'm doing this test. And
Yeah.
when I got the results, I was like, ah, no wonder,
Yeah.
you know. So sometimes you need to be the one that is the advocate for your own health because you're the
Yes.
one that has to live with the consequences, you
Exactly.
know, and not
Exactly.
just because, well, my doctor said,
Yeah.
and no disrespect to any physician, but you know, they're not gods. And it is so important to educate yourself. And you do, like you were saying, you should know your own body
Yep.
and be able to make those decisions whether or not, okay, you know, despite what my doctor says, I'm going to go ahead and do this test every,
Mhm.
you know, 3 months, every 4 months, whatever, because I want to know where I'm at health
Mhm.
wise. I
Yeah.
mean, if you can find something, you know, stage 1 versus stage 4, why on earth are we not encouraging people to do early prevention of things?
Absolutely. Yeah. And like the only way to really personalize your own health is to get the data around it, right? And
Yes.
usually, like you'd have to rely on your doctor to give you that data, or for your dentist to give you that data to tell you, like, oh, on this X-ray, this looks like a cavity. This looks like you have a worsening pocket. But
Mm.
now, like you can do all of this at home. Like there's so many tests you can take, including the Bristle test, that allow you to really take control of your own health. Um, we just gotta educate people about it, right? It's like
Absolutely.
they don't
And I
know.
think too, some tricks is like cross training the gums,
Yeah.
because too many times when I am evaluating someone with their plaque control, I can kind of see that they're missing the same spots every
Yep.
single time. And it's
Yes.
like they go into a zombie brush, right? They
Yep.
don't even think about what they're doing. They're just like, you know, so it's being what's the word I'm looking for? More focused into what you're doing when you're spending that time with your oral care. Pay attention to what you're doing. You need to floss properly, which most people don't know how to do. So please go to my YouTube channel, Simply Silver Mouthwash, and watch my video on how to floss. You
Yeah.
need to go underneath the gum. Okay.
Yep.
Popping it in between your teeth does
Got it.
nothing. I really hate those little cheaters because all they do is transfer bacteria from one part of the mouth to the
Mhm.
next, and they
Yep.
don't go underneath the gum.
Yep.
And it's just, you know, giving people a false sense of I'm flossing and not
Yeah.
doing them a darn bit of good. So having the right tools and sometimes doing things differently, like using an end tough brush. A water pick is a must. I mean, you really need to have a water pick. I like the Hydro Floss. Are you guys familiar with that?
Yeah. Very similar to water pick, but yeah.
Love the Hydro Floss. It uses a magnet, so it's already
Mhm.
killing bacteria before it even gets to your pocket, which is fantastic. So I actually sell them on my website, by the way. Yeah, it's really just kind of fine tuning what works for that person, getting them
Mhm.
on the right supplements, which I love the fact that you guys recommend probiotics. You know, I have gone back and forth with a periodontist in the UK who's like, there is no research that says that eating probiotics is helpful. What is it that I can show him or tell him that might change his mind? Because he just doesn't believe me when it comes to that.
So, fortunately, I have done all the research on this.
Oh, good.
Um, and there is a blog that we have written. Um, I can share it with you in a link afterwards, but
Okay.
it goes through all the clinical trials for basically any clinical trial about probiotics and periodontal disease, or probiotics and cavities, or
Mhm.
probiotics and halitosis. Um, and so, in summary, there are probably 3 or 4 very good species that have been shown to reduce the either the incidence of disease or to improve the symptoms of disease, um, for any of those cases. And so, in summary, basically, there are 3 of them that are high confidence. The first is Streptococcus salivarius.
Mm.
It's extensive research. It's a beneficial species that's in higher abundance in the people who are healthy versus the people who are not.
Mhm.
The next one is Lactobacillus reuteri. Lactobacillus reuteri creates these molecules called bacteriocins, um, that can kill other bacteria. But the way it happens, we're not really sure because they kill very specifically. They don't kill everything, they only kill a subset of these anaerobic pathogens that can cause disease. Um, so you may be familiar with it because it's also in a lot of gut probiotics,
Mhm.
because it has been shown that it colonizes the gut and improves health. And the last one is Lactobacillus paracasei, which can actually fight Streptococcus mutans. So people who have high strep mutans should be taking that. Um,
So
to
let me just ask you then, David, are those strands not in your typical probiotic?
No, they're not.
Interesting. So
A lot.
which probiotics contain those specific ones?
So there's a few. There's very few really good oral probiotics. Um, we worked with a company called Superteeth, Get Superteeth, that that sells one that's really good. So it has those three things in it. Unfortunately, there are other probiotics on the market that just take all the strains that people have used in gut probiotics and try to
Uh,
put them in an oral tablet. And unfortunately, most of those do nothing for you, because when they're in the mouth, they don't do the same things as if they're in the gut because the environment is totally different. Um, and on top of that, some of them actually contain kind of bad species for your teeth. So
Interesting.
one of them is Lactobacillus gasseri, which is associated with cavities because it can create acid from sugar, um, and sometimes that's in a probiotic. Um,
Interesting. You see, I'm learning something right now because I do recommend probiotics, but I
mhm,
did not realize
yeah,
that there could be perhaps some harmful ones that,
yeah,
are not good for them to be taking. So I definitely want to know which ones I should be recommending to my patients. So if you could definitely send me the information on that,
absolutely,
I want to get people on the right supplements.
will do. Yeah.
Awesome. Well, what else would you suggest as far as the because I know in my own research for gum disease, I found that people who had more of the propensity for gum disease were actually lacking CoQ10 in their body.
Yeah. Oh, yeah.
So, do you guys recommend that as well?
Yes, we do.
Okay, good.
We also recommend. So there were a few studies that showed that there's an optimized diet for people with periodontal disease, and so CoQ10 is one of the things that people recommend. But another one is omega threes,
Yeah.
um, very powerful anti-inflammatories, and people think that the way that they work is because by reducing inflammation, you're actually changing the niche so that those bacteria that cause inflammation they don't have as much uh, power to grow, basically. Um, because these pro-inflammatory environments are really good for harboring these pathogens. Um, and there's a few other vitamins that are pretty common that people take, but people are still deficient in vitamin D, vitamin C, also potent anti-inflammatories.
And also, people that have that MTHFR mutation,
Mhm,
they don't detoxify very well, and they
mhm.
can't. They have an issue with the B vitamins specifically.
Yeah,
So that is also can be another root cause of
yeah,
why we're seeing a breakdown in the mouth.
yeah.
So, and that is an easy test to actually check for. It's like a
Mhm.
$70 saliva test that you can order on Amazon for Pete's sake.
Yeah,
But
yeah,
sometimes you do need to spend the money on the testing. Once you're able to come up with like, okay, this is what I tested positive for, what's the game plan? And
mhm.
then I feel like you're able to make a much more informed decision.
Oh yeah.
Like, the fact that I was oxalate toxic. I mean,
Mhm.
I had no idea that changing my diet that much was going to
Yeah,
create such a problem for me.
yeah,
And then now I'm like trying to, fix that, and I'm doing things specifically for digestive health, which has made a tremendous difference. Now I don't feel like my stomach is so upset all the time. But I've had to like not eat spinach, not have almond milk, and just kind of slowly make those changes. But at least I had the testing to show me what was wrong,
yeah,
you
yeah,
know. And so that's where really being your own advocate and figuring out what's going on, and the fact that you guys can assist people in getting to the root cause I just love that. Are you guys available in just the United States, or I mean throughout the world? Kind of explain, like, if somebody wants to do this test, is it available to absolutely everybody, or just the
Yeah, good question. I think we recently opened up our doors to Canada. I'm not
Okay.
sure other countries. Um, if you send support an email ticket, they will get back to you. I think we might be sending to some other countries. I think we've sent some kits to the UK, some to
Awesome.
Australia. Um, but of course, like the only caveat there is that your results are probably going to be a little bit delayed because of the shipping time.
Mm,
So when you ship your saliva sample back, we usually say that you'll get your results between 2 to 3 weeks later.
mhm,
But with international shipping, we don't always know. It's pretty difficult for us to ensure that turnaround
mm.
time.
Okay, well, that's good to know too, because like I said, I offer your test on the website.
Yep.
And, I have products that are containing arginine and
Yeah.
hydroxyapatite, which I think you guys
Oh yes.
also are a
Absolutely.
proponent of, because
Yes.
I love anything natural. So, the nanohydroxyapatite, a lot of people are not familiar with this
Yep.
ingredient,
It's
but
just.
it's been used in Japan, since the 80s. NASA uses it.
Mhm.
It's bioidentical to enamel. It
Yep.
is completely non-toxic, and it's
Yep.
really a great way to remineralize teeth.
Yep. It
Yeah,
is. It's just the surface of your teeth, basically. It's
right.
pretty
I
crazy.
know our teeth are 97%
Nanohydroxyapatite.
hydroxyapatite.
Yep.
That's what your teeth are made out of. So yeah, I'm so glad you guys make those recommendations. Um, but I just really wanted to make sure that we post this on YouTube and try and get the word out there. If they want to purchase a test, they can go to my website. It's simply silvermouthwash.com, and I have it available, I think, under services. But I'm a very big advocate of you guys, and I
Well,
really
thank you.
hope that we can see your testing available in more and more offices, and
Yep.
just get the word out.
Yeah, absolutely. Thank you so much.
Well, thank you
This is
for
great.
this interview. I really appreciate it.
Yeah,
It was
thank
great
you.
chatting with you.
It was fun. And